Right.
There's a lot of vaginal bleeding. I would have done some other things to rule out a laceration in the birth canal, but then I would put my hand on the abdomen, starting up fairly high, to feel what the uterus felt like. And so this is the diagnostic part of it, where I'm saying to myself, is this uterus atonic or is it well contracted? Because if it's already well contracted, then I'm not going to need to do massage. I'm going to need to explore the cavity instead. So what I would be doing at this time is feeling the fundus, and if it was soft, like I'm feeling here, I'd say this is the reason for the for the bleeding. And so I would do two things. I would put my hand into the vagina so that I had something to push against. And I would now start to really firmly, so the problem here is that the whole model is moving, and that wouldn't be happening. I could apply very firm pressure, not just downwards, but really a massage. And I can't do this because the model's moving. So I want something that's more stable. And the uterus right now is really ill-defined, and now it's concave. And so that's very unrealistic, because a woman's uterus usually is going to be, I don't have to dig for it. And here I'm really having to dig for it. So I want it to be a little more prominent, and I want to be able to massage like this, and I want to be able to have the uterus exist as it gets smaller and my massage is working, that I'm feeling it in between my abdominal hand and my vaginal hand. And there's just nothing that I'm feeling now. So I feel this firmness over to this mom's right side, so that's very unrealistic. Sometimes the uterus is fairly floppy, but never to this extent. If this is the midline here, this is more like an adnexal mass, an ovarian mass, rather than a firm uterus. So it feels, the consistency is good, feels like a firm uterus, but it's offset.